Hi, I'm Hilary Vance, and I'm doing my presentation on the effect of loud noises on hearing. How does the ear work? Sound waves enter the outer ear, causing the vibrations to impact the eardrum. They are transmitted to the middle and inner ear. In the middle ear, there are very small bones. These include the incus and the stapes. These amplify and transmit the vibrations generated by the sound to the inner ear. The inner ear contains the cochlear. The cochlea is filled with fluid and lined with cells with very fine hairs. These hairs move with the vibrations and convert the sound waves into nerve impulses. This results in the sound we hear. Too much exposure to loud noises can destroy the hair cells and cause hearing loss. Physical and psychological health effects. There are two types of health effects. The first is auditory, and this includes hearing impairment and hearing loss. The second is non-auditory, and this includes stress-related, psychological effects, behavioral effects, and physiological effects. How does loud noise damage the ear? Loud sound is collected by the ear as sound waves. The sound waves travel down the ear canal toward the eardrum with enough force to disrupt the hearing system. If the sound is loud enough, it can dislodge the tiny bones of the middle ear. The sound passes through the middle ear and travels to the inner ear. The tiny hair cells lining the cochlea can be damaged as the loud sound reaches the inner ear. Only healthy hair cells can send electrical impulses to the brain. It is in the brain that the sound is understood and interpreted. Hair cells damaged by loud sound cannot send the impulse to the brain for interpretation. There is no current treatment to repair the damaged hair cells as of today. Some physical problems include high blood pressure, increased or abnormal heart rate, an upset stomach, insomnia or difficulty sleeping, and disruption of the development of a baby before birth. Some psychological effects include muscles will burst into activities as the startling response to loud noise. This occurs even after the noise stops. Muscles will contract in the presence of loud noise. And this occurs with no intention to protect. The respiratory rhythm tends to change when noise is present. There is a change in the heartbeat pattern and changes in the diameter of the blood vessels, particularly in the skin. The importance of this concept is good to know about because your ears are a very important part of your body and you should know how they work and how sensitive they are. Your ears can handle only a medium level of noise before they start to damage. After learning about this, many will start to protect their ears from the loud noises that are very harmful to them.